You open your eyes in the morning, and the very first thing you notice is not energy or freshness or readiness for the day. The first thing you feel is a completely dry mouth. Your tongue feels rough like sandpaper. Your lips are cracked. Your throat feels dry as if you swallowed dust during the night. Instantly, you reach for water because it feels like you have not had anything to drink for days, even though you had water before going to bed. Most people simply drink some water, brush their teeth, and move on. They assume it is normal. They believe everyone wakes up this way. They think it is just part of sleeping. But if you are waking up with a dry mouth regularly, your body is sending you a strong signal. Ignoring that signal could mean walking towards serious health problems without realizing it. This is not meant to frighten you. It is meant to inform you. Over many years in medical practice, I have seen patients whose complaints began with something as simple as dry mouth in the morning. When we looked deeper, we sometimes discovered unexpected health conditions that could have been identified much earlier if attention had been paid to this small symptom. My name is Dr. Clarence Martin, and today I will explain what your body may be trying to tell you when you wake up with a dry mouth. I will cover the science behind it, the hidden causes that are often overlooked, and most importantly, what you can start doing about it tonight. Stay with me through this entire discussion because the information toward the end could truly impact your long-term health. Let us begin with the basics. Your mouth is designed to produce saliva continuously. Even during sleep, your salivary glands should remain active. Production naturally slows down at night, but it should not stop completely. Saliva is far more important than most people realize. It contains enzymes that begin breaking down food before it reaches your stomach. It has antibacterial properties that protect your teeth and gums. It maintains a healthy balance in your mouth to prevent harmful bacteria from taking over. It keeps oral tissues lubricated and healthy. When saliva production drops significantly, especially during sleep, the environment inside your mouth changes. It becomes a place where problems can develop easily. The dryness you feel in the morning is the result, but the dryness itself is not the main problem. It is a messenger indicating that something deeper may be happening. One of the first things to consider is how you breathe while sleeping. This is the most common cause. If you breathe through your mouth at night, dryness is almost guaranteed. Air constantly passing over your oral tissues evaporates moisture, and by morning, your mouth feels extremely dry. The next question is why mouth breathing is happening. For some people, it is due to nasal congestion, allergies, a deviated septum, or chronic sinus issues. For others, it may be related to a more serious condition called obstructive sleep apnea. With obstructive sleep apnea, the tissues at the back of the throat collapse during sleep and partially or completely block the airway. The body responds by opening the mouth to get more air. Loud snoring, gasping, or choking sounds during the night, frequent awakenings, morning headaches, and persistent fatigue can all be signs. Untreated sleep apnea places significant strain on the heart and blood vessels. Each time breathing stops, oxygen levels drop, and the heart must work harder. Blood pressure rises and stress hormones are released. Over time, this increases the risk of high blood pressure, heart attack, stroke, irregular heart rhythm, and even sudden cardiac death. A simple symptom like dry mouth can be an early clue. Another important cause is diabetes. When blood sugar levels remain high, the body attempts to remove excess glucose through the urine. This leads to more frequent urination and fluid loss, which results in dehydration. One of the earliest signs of dehydration is dry mouth. If you also notice frequent nighttime urination, excessive thirst, fatigue, blurred vision, or tingling in your hands and feet, your blood sugar levels may need to be evaluated. Early detection allows lifestyle changes and treatment that can prevent complications such as kidney damage, nerve damage, vision problems, and poor wound healing. Medications are another very common reason. Many drugs, including those used for blood pressure, depression, anxiety, allergies, and pain, can reduce saliva production. Antihistamines, antidepressants, certain blood pressure medications, especially diuretics, muscle relaxants, and anti-anxiety drugs are well known for causing dry mouth. If you notice dryness beginning after starting a new medication, discuss it with your doctor. Alternatives or management strategies may be available. Chronic dry mouth can lead to serious oral health issues. When saliva is reduced, the balance of bacteria in the mouth changes. Harmful bacteria multiply, leading to cavities, gum disease, and infections. Gum disease itself has been linked to heart disease, cognitive decline, and diabetes. What seems like a minor inconvenience can contribute to broader health problems. Dehydration is another factor, and it is more complex than simply not drinking enough water. Coffee, tea, and alcohol increase fluid loss. Intense exercise without proper fluid replacement can leave you dehydrated at bedtime. Diets high in sodium require additional water for balance. Dry indoor air from heating or air conditioning can also pull moisture from your body overnight. All of these factors may contribute. Autoimmune conditions such as Sjogren's syndrome should also be considered, especially if dry mouth is persistent and accompanied by dry eyes, fatigue, and joint discomfort. In this condition, the immune system attacks the glands that produce moisture. Early diagnosis can improve quality of life and help prevent complications. Stress and anxiety also play a role. When the body activates the fight or flight response, saliva production decreases. Chronic stress can therefore contribute to ongoing dryness, especially during sleep. A dry mouth in the morning may seem small, but it can be a valuable signal. Paying attention to it and identifying the underlying cause can protect not only your oral health, but your overall well-being.